All right, good afternoon and welcome everybody. This is your host of the day, Cade Archibald, and really excited for today's show. We got an awesome guest that we'll be introducing here in a moment. And so we'll be diving into some really cool stuff on kidney health today. So before we jump in there, we're going to cover a few specific announcements, what we have coming up. We got some really cool stuff coming up. I'm going to hand it off to the amazing Annie Asher to go over a few of those things. Annie, what do we got coming up?
We have session 4 coming up December 3rd and 4th in Salt Lake City. It will be at our patient teaching center at the clinic. So it's going to be a new venue, kind of new energy. We've got all kinds of great stuff planned on business building, functional medicine, functional blood chemistry, all the good stuff, integrating some new service centers into the practice. So make sure you're going to be there. If you are not, please make sure to watch live via Zoom. We'll be streaming it, of course. So
awesome. Thank you so much, Annie. Yeah, we're like leveling up our game. So hopefully you guys watching the recordings of this are are just enthusiastic, because right now there's going to be something that flashes across the screen in my face. All right, well, let's dive into today's topic. Last week, not introduced, but there were some questions coming up from Dr. Robin Rose, and she referenced a lot of things on kidneys, and so she is. I'm sorry, I want to say nephrologist now, and we just talked about this. It's
Rhenologist.
Rhenologist. I love that term. Way better than nephrologist.
Yeah.
So she is going to be sharing some really good nuggets on kidney health, and some of what she helps with her patients. And you are in the beautiful state of Hawaii. Am I right, Robin?
Indeed.
And
Molokai.
Which island are you on?
Molokai.
Molokai. All right.
Molokai really is Hawaii. The willingness of this island to allow change is very small for a great reason, and we're very grateful because it's kind of nutty over there on Maui, I think.
Well, great. Well, we're so excited to have you on. Reagan, I'm going to turn it over to you to ask the more intelligent questions. Otherwise, I'd probably just talk about Hawaii the whole time.
No, appreciate it. And Robin, so good to have you with us. And you've just been a dynamic part of our community here since you joined, a few months ago. So welcome to Go Wellness. And today we're going to take a deep dive into kidney disease. And do you mind if we talk about your own personal experience with your?
No, I'm really happy to, because it is the portal.
Yeah. So how did you get into this? And maybe you could walk us through what it was like to have chronic kidney disease.
Well, my story is, it all started in the 60s. Yeah. I'm that old. And really walking through a portal of change. You guys are all the babies that I'm glad we had. and so my entry into medicine really came that way. I did it with the intent to, quote, raise hell, because I saw a lot of what was going on in medicine was somewhat hellish, as we all in this kind of community know. And that was a long time ago. I became a nurse. I lived in India and hung out with a doctor in a fishing village. That was my true initiation. And living on Molokai kind of reminds me of that in a way. It's a similar kind of community, and so the idea of a small cluster community caring for itself really has always been my dream. And I did my residency in family medicine in Santa Rosa, and I am one of those people who did the UCLA acupuncture training.
Oh, nice. That's
And
great.
so I actually was getting paged when I was an intern to like needle somebody in OB. It was a cool community, so
Wow.
we had an apathy clinic, I was able to pull off putting magnesium and vitamins in my inpatients' IVs, I mean, could get away with it, but it was still very conventional. And my practice was in Ashland, Oregon, and embraced by a community that
Mm,
adored the fact that I was hanging on to that. And
yeah.
yet, still, plenty of conventional practice. And my own awareness of kidney really had to do with Chinese medicine thinking, regenerative ideas. And yet, I wasn't any smarter than any other primary care doctor about kidney. Kidney people, I mean, I've, can I share a little bit about this? Because it's my
Please do.
process
Yeah.
of figuring it out. I've had to say, what's wrong with this? I mean, and I have personal reason for having asked that. And so not that long ago, we really had very little. And so the doctors who were taking care of kidney patients had sick people. By the time you even figured out it was kidney, these folks were sick.
Yeah.
And doctors who take care of really sick people live in a sheltered headspace.
Mm.
It's I mean, it's challenging. I mean, I was encouraged to do oncology, oh, you would be so wonderful in oncology. And I was like, no, 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 primary care, the array of real life. I had plenty of very sick people, but there was the kids and the healthy elders. And, the mind state for kidney disease really was torqued by history. And ironically, it was Linus Pauling, who had kidney disease, who helped develop dialysis.
I did not realize that. Linus
It-
Pauling, the vitamin C guru.
right? I can't
Here.
that link. I have this fat book called The Kidney, 2 volumes. I can't find that the one little paragraph, but
Wow.
the fact that dialysis replaced all of the lifestyle awareness. That was all they knew to do.
And when, so that must have been the 90s, I take it, is when dialysis came on, or was that earlier than
It was
that?
way earlier than that. I mean, probably more like 50s, 60s,
Oh,
70s.
wow. Okay. I was way off.
It started getting developed. But what happened is generations of nephrologists gave up on everything but.
Hmm.
And I have compassion for them, but I
Sure.
also have big criticism because so my story, yesterday was my 11th anniversary. And around that time I was getting ready to go. I've had enough of this. I wanted to follow my hiking husband around instead of sitting in a box all day and
Yeah.
and ended up on Molokai and started getting sick. I got a norovirus
Mm.
and had an enormous amount of stresses. I mean, really serious ones. My medical practice was profoundly embezzled.
Oh, wow.
Not cool. And
Oh,
stress in trying to deal with that. My dad got demented and we had to place him, and my mom went kind of bonkers. And so I sold my practice, sold my building, sold my whole life, and moved in with my mother, who was a challenge. And then she ended up dying. My partner at that time assaulted me.
oh, wow.
So I left, and a week later I met Paul. Interesting.
And
But
you guys celebrated 11 years yesterday
yeah,
on Halloween. Congratulations.
and we paint ourselves up every year. Anyway, I started feeling bad. I'm in love, I'm madly in love, but I'm like, what? And I was on Molokai, I got a virus, didn't want to go to the little hospital here. So we did acupuncture and homeopathy and herbs. When we went back to Ashland, we bought this house. I started having like mental derangement. I was going absolutely wacky. Things were tweaking me in ways that did not fit this person. So I went to a newly trained integrative doctor who basically, I mean, it was ridiculous. Honestly, she got in my face and basically like taunted me. Repeat after me. I am healthy. And I'm like, what's your name? My blood pressure's 220 over 110.
I'm gonna stroke out. That's not helpful.
Well, I was really angry. Still have a bit of leftover like process with her. And I had a tumor.
Wow. Okay.
And I'm like, me, health food Hannah has a tumor?
Yeah.
A lot of stresses. I don't, who knows? And, my SNPs are over the top. So it's like, okay, my hormetic zone got overrun. I had clarity. It's interesting because, do you know Cedar? He's you guys would love each other. He's a genius, brilliant acupuncturist who I was running to right away. And he was like, you want to do the surgery. I encourage you to do that. And so I was clear, cut this thing out. 3 weeks later, I was here in Molokai, but I'm not doing well. And came back to Oregon 3 months later to have a follow-up scan and found out that my GFR was 31.
Oh, yikes.
So I saw a nephrologist who basically, this was the brilliant advice that I got. Don't worry about it. People live in stage 3 for 30 years. I said,
it's only
okay.
stage 3.
But stage 3 starts, how much loss you already have with a GFR of 60? You've already lost 50%.
Right.
What organ do we allow? 50% of your brain? No problem. Wait till it's 25%, and maybe we'll put plumbing in. And that attitude is really ridiculous. And so when I said, well, what about a diet? Well, he eats a vegan diet, but he doesn't recommend it. So 5 nephrologists later, I finally gave up. And this was over many years with advice that was worthless. And I laid on my couch one day and basically called out to the universe, I need help.
Yeah.
I can't think straight. I leaned out, pulled a Townsend letter off the table, opened it up to an article by Jenna Henderson, a naturopath who does only kidney.
Wow.
Called her up. Hello? So I went off and got labs, and Jenna really set me on a path. And I have profound gratitude. And then I found Facebook groups and lay people who were really amazingly educated and helped me out. Well, I started a Facebook group and had several hundred people who didn't know I was a physician. Wow, you know a lot. Maybe you should consider going to medical school. I was like,
you're like, been there, done that.
It's like, and so I just started researching what was wrong with me. My potassium was elevated. Oh no, you don't have elevated potassium in stage 3, but I do. I am starting to think, there isn't clarity of thought here. And so 8 years later, I have more knowledge about early kidney disease than anybody else. Because, if you think about it, what are we waiting for? 50% loss? And maybe it was like, let's see, nephrologist number 4 literally did this. And I like to talk about it because I'm educated and I was overwhelmed by the attitudes. Think about what most of the public walks in. Back, I have to fly to either Maui or Oahu. So already I'm spending like $400 just to get there. And it was harassment. This guy was this beautiful Indian man who basically says, so will you do dialysis when you're 95? I'm like, I guess he thinks I'm going to live a long time. No. Well, what about when you're 85? I'm like, I'd already said, I'm not planning on doing dialysis. Well, what about when you're 75? And I said, why don't we talk about what I need? Like, what about protein? And he said, I don't talk about that with my patients. They don't even know what amino acids are. So I said, well, I could give you a lecture on them. And he's like, well, I just don't do that. I went
Wow.
cried for 2 days because I was scared and continued with this research. So basically, I've done a lot I just did labs. It was 57.
Look at that.
And, that's like, that supposedly doesn't happen. I've done much, worked on diet. So my attitude about early kidney disease is let's not neglect it until people are so sick it's hard to fix.
Yeah.
In Chinese medicine, thinking of kidney is so similar to my own. So I kind of went around and came back to it with the research that's mostly been, there's a lot of human studies, but basically we have so many tools. And what we don't have is the ability to step in. I mean, I'm part of, this giant physician community on Facebook. And I've brought this up gently, like early on, like when we start early, we can eliminate the progression. If you start in stage 2, which they don't agree is abnormal. And I think it's not considered an illness because there isn't a pharmaceutical.
Right. Yeah. No
Still-
treatment. So there's no disease.
So, okay, it's normal. I'm like, wait a minute. No. So, Dr. Robbins says greater than 60 is not normal. I mean, it seems so obvious, talking to you. I'm like, what am I even talking about this for? And yet it's a pandemic. It's a real pandemic. It is all over the place. They say like 50% of people over 60 or something will have some deficit in kidney and nobody will know what to do. This current little bug that's going around is making it worse, both the disease and the cure. And so-called, not really. And so we don't know what to do. And my story was I was getting better and better. I got up to a GFR of 51 with all of my lifestyle efforts. And then I've discovered, we think of it as a filtration disease, but when you really look at it, it's mitochondrial disease, it's a nitric oxide deficit, it's a read abnormality. I mean, everything I look up, I had an abnormal CD4, CD8 ratio that I'm currently freaked out about. Just did Foxo.
Nice.
I think it helped. I think it helped because I'm over the, I think I herxed. I was a mess.
Yeah, you
and,
mentioned that. Yeah.
and all of a sudden I was like, woo, oh, look at this. I mean, really noticeable. So I'm delighted with that. So, so we don't think of kidney disease as a syndrome, but it's enormous. It affects absolutely everything. It's a systemic illness.
Hey everybody, Reagan Archibald here with Go Wellness. And if you liked this episode, if it actually helped inspire you to be a better practitioner, help more people, establish a much better foundation for your business, then I'm going to ask a favor of you. And that favor is for you to share this with somebody you care about and love in the healthcare field. I don't mind if it's an acupuncturist, a functional medicine practitioner of any sorts, a naturopathic doctor, a medical doctor, any type of endocrinologist or specialist. We need to get this community strong, and we can't do it without your help. So I want to thank you from the bottom of my heart for all the hard work you're putting in and day out. I know it can be a grind, especially with some of the chronic cases that you're treating, but this show will help transform the way that you think, help transform the way you practice, and change the lives of thousands. Thank you for being part of our community.